Johns Hopkins is dropping a major insurance carrier because they can't negotiate with the insurance companies anymore for favorable contracts. There's 90,000 patients in central Missouri were left caught in a contract dispute between MU Healthcare and Anthem. Big surprise there. Their agreement between those two had lapsed. It has remained unresolved since then. United Healthcare and Memorial Sloan Kettering briefly left patients in limbo in New York City. And Duke Health in North Carolina is warning that it might exit Aetna as a network without favorable renegotiation. So looks like more and more hospitals, more and more healthcare systems are going to be dropping different insurance companies for different reasons, but basically because the reimbursement rates have gone down so low versus inflation, and the insurance companies are not willing to renegotiate anything. I want you to know doctors' reimbursement rates have stayed relatively flat or gone down over the last 20 years. I'm just letting you know your care is suffering. Your care is suffering because the reimbursement rates would dictate that in order for the doctor to continue to run the practice the same way, if reimbursement rates have stayed the same for the last 20 years and inflation has doubled the cost to run the practice, what does that mean? It means that doctor and provider has to see double the number of patients in order to sustain the same revenue. What does that do to you, the patient? Well, it means that your visit's going to be shorter because there's no way to see double the number of patients in the same amount of time. You're going to have to cut something. So you're going to cut quality of care. You're going to cut the time, right? Reimbursement rates have been horrible last years. Medicare, as an example, use Medicare relative value units over the last 20 years versus inflation. And you're going to see that it's a flat line for reimbursement and inflation's doubled. I know a lot of you are relying on your insurance to take care of you, to help you out. I'm just letting you know that the places you're going to try to go to get care are fed up with the insurance companies. And if you're so reliant on your insurance, you better be looking elsewhere. You better be trying to find other solutions because the doctors that you like are getting sick of it. Anyway, Dr. Dave Morris of Magnolia Medical Center here in Murfreesboro, Tennessee. We do root cause functional metabolic medicine. Very little of what we do is covered by insurance. And even if it was, I wouldn't want the insurance to handle it, not because I don't care about the patients, because I can make it cheaper for the patient usually to care without their insurance. So find somebody that does direct primary care. It'll help you out. Take care today.